So it's definitely distinct from the underlying joint. So it's not a ganglion, which we'll see fairly often. This seems more consistent with a cyst that maybe is a little bit calcified. So we're just going to be freezing underneath. We'll just do a wedge extension, then stitch this together. Wedge extension, sorry. So you could either do a digital block here, or you could do a local one, which is a local. You're going to feel a poke here. Poke here, I apologize. You're going to feel a burning. And generally that's what I want to see. I want to see the tissues. You're trying to put some underneath it. See that's inflating here? Mm-hmm. I'm working with a Dr. John today, / Dr. Laser. Yeah, he prefers laser. No pain here when I do this?
No.
So obviously when we're doing this, what am I worried about? So structurally, where do the nerves run, where the tendons run?
Your digital nerve and those
Yep. And where are those? Are those down the middle or these are lateral, right? So down this side you have to worry about nerve endings, and then down the middle portion, that's where our tendons are going to rise, right? So, but we should be superficial to all of that. So my point being is we're going to be doing the elliptical incision, but just into the dermis and hypodermis, and then coming back underneath it. So we should be avoiding all of that, but you should be aware of them because you just want to make sure that structurally you know where you're dealing with things. Now, another thing you could do, I'd usually demonstrate without it, you could put a tourniquet on this finger to minimize bleeding. I always do this just to show you that even if you didn't have one, you can do them. So it's going to be a little bit more wet as a field. And again, why do I do an elliptical incision? Why not just cut it right off at the base? There's really two reasons, but can you think of one?
Is cosmetics part one of them?
Cosmetics is one of them. So typically, not as big an issue here, but when I want tissues to come together, if you just cut a circle out, then you'll get more of that dog earing happening.
Right.
So what the dog earing means is that the tissue just bunches at the ends because it can't come together nicely. When you do an elliptical incision, you'll allow that to not happen.
And the second reason is just ensure depth.
Yes, that's the other one. So sometimes not as big an issue here again because there's no part of this that looks even remotely cancerous. But if you were taking out a cancerous lesion, this way you know that you have clear margins. So you can see there, see how that's separated from the dermis, how that's gaping a little bit. No pain there at all. So once I've dissected away one end, then I just dissect it along underneath it through to the other side, and then we'll be done with that. And that's it. So that's actually quite firm, which is what I expected to be. We'll take a look at that in a second. So what about cauterizing this space underneath this lesion? Should I cauterize all of those? What do you think?
You could just use the suture for...
Yeah, because in this case, we're going to be able to tamponade it, right?
Yeah.
So you certainly could. There'd be nothing faulting you from doing that. But with areas that are just superficial, you're going to be tamponading all of them, and you'll never have a hematoma here. But I wouldn't fault anybody if they decide, oh, I'm gonna cauterize those. Certainly, tying off areas would be something you probably are going to be avoiding, just because again the tissues are such as they are. If you're tying it off, you're going to cause a swelling underneath the tissues, and he'll feel that. So here again, this is about also getting comfortable with what's excessive bleeding, what's mild bleeding. This is actually mild. So here, if I'd had this, tourniquet off, there'd be less of this. But if you were in a situation where you're operating outside of your office, or you just, you don't have tourniquets, then you can still know that this is something you can do and not have problems with doing it. The other problem I used to run into from a teaching perspective is my tourniquets would walk away on me. I never knew which resident would run away with them, but
Oh, really?
yeah.
You didn't just have those little blue ones?
Yeah, and they would go missing.
Oh, really?
And inevitably, how many can you have? We still have them, but. So you can see already how that bleeding's settling down.
Yeah.
And you're still comfortable?
Yep.
So Dr. Laser, why don't you put in the last one?
I'll step out.
Or you have no gloves? I'll do the last one. I'll have you do the next one. That's my fault.
But thank you for using my appropriate titles.
Yeah, no trouble. You have so many appropriate titles.
Right, right. Well, as you advance through your medical training,
Exactly, you should progress.
your title should reflect personally fellow laser.
Oh, that'd be nice.
We'll post this video.
So that looks pretty clean. No issues there whatsoever. So we'll leave that. Because it's on a joint, I wouldn't take those out too quickly. So as opposed to like 5-7 days, it'd be more like 10 for sure. But that should heal nicely for us.
And today, over on Patreon, Dr. Butler gets an assist from Dr. Laser once again to remove this woman's cyst that is underneath her eyebrow. Here's a clip of that. As always, you can find the link to the video in the caption. Have a great day.